Welcome back to another exciting episode of the Your Best Lifestyles Health and Wellness Podcast. I am your host, Terrance Hutchinson, right here at the Old Robinson Public Relations and Media Group Studios on the outskirts of Atlanta, Georgia. Listen, happy Sunday. Hope you guys are doing well. Glad to see you. Hope you guys are making sure that you're eating right, exercising, praying, meditating, drinking your water, stretching, doing all the things that you need to do to take care of yourself, all things health and wellness. You know how we do it. Happy Sunday afternoon. It is 12:13 here in Atlanta, and it's gloomy outside. The sun is starting to peek out right quick, but I hope you guys are doing well. It's Super Bowl Sunday for all my friends and family out there in Las Vegas. Make sure you be safe. You understand that? So we are back. As you know, like I said, we are a health and wellness podcast, everything health and wellness. I'm not gonna go into any type of announcements right now. We're gonna get straight into the show because earlier we was having some technical difficulties, and I'm trying to prevent that right now. So I got an amazing guest for you guys right now that's on the line, all the way from Denver, Colorado. His name is Dr. Mark Levandovsky. MD, a 20-year triple board physician, oncologist, hematologist, and internal medicine, right? He leads a leading concierge practice. He specializes in finding and locating heart diseases and cancer and preventing it before it becomes a risk to a person's overall health. So essentially, he just do integrative medicine. Welcome to the show, Dr. Mark Lewandowski. How you doing today, sir?
Thank you so much for having me on the show. Doing great and great to join you.
It's such a pleasure to have you here. Thank you so much. Now, listen, you are triple board certified. That means a lot. So that means that you know everything pretty much what's going on when it comes down to cancer and different chronic illnesses and try to prevent them. So why do you feel like it's so important that people focus on the prevention of certain cancers? Because a lot of people they don't really take too great care of themselves, especially as they age. So why do you think prevention is the key? Or why do you feel prevention is the key?
Great question. Unfortunately, the way things are right now in medicine, if you follow the standard guidelines, you do everything that is recommended by, say, your general practitioner, and you stay on top of it, well, you would only be able to pick up 7%, actually 14 to 17% of cancers that you might develop. The vast majority of what's going to kill you, what's going to really cause morbidity, mortality, loss of quality of life, loss of work, and happiness, is
Mm,
going to be completely undetected until it's too late. So 14 to 17% at best, and 75% of what kills us goes completely under the radar.
mm, mm. That's amazing. You said something interesting about the quality of life or the activities of daily living. People don't understand when they get diagnosed with some type of cancer or anything that's chronic life threatening, the quality of life diminishes right away. What do you think is the first thing that really diminishes the quality of life when they get a diagnosis like that? Is it the mental health, emotional, or the physical health?
It's certainly, as soon as people hear the big C word, the cancer word, right, the psycho-emotional aspect just tanks. It happens time and time again. People are just incredibly scared of it,
Hmm.
very much understandably. And the anxiety and the sadness and the acceptance phases and just the overwhelming fear and desperation
Yes.
is suffocating, and
Hmm.
it's pretty much ubiquitous. Most The more spiritual someone is, the more connected they are, and actually women tend to do
Yeah.
better because they're just more awesome than us guys,
Hmm.
right? They're just more integrated and connected to the society by and large. But nevertheless, regardless of your walk of life, of your sex, or what happens, it's a huge, huge shakeup. And that's really even before the physical aspect and the treatment and the discussions and the loss of time and work and family
Right.
happens. It's a huge shakeup.
Yeah, yeah. In 2009, I lost my father from lymphoma, and
Mm,
first he was dealing with it. He went through all the treatments, and then he was pretty much clear. So he's out exercising in his upstate New York, Rochester, New York, and he was in remission. Everybody was happy. Then he caught pneumonia, and then the cancer came back, and he went through the treatments again, and he was like he was just tired. He was just ready to go. So, and he was a big guy, he's 6'3", 240. So it's like one
mm.
of the strongest guys I know. But psychologically and emotionally, he just felt defeated. And I the doctors told us, well, they can't treat the cancer and pneumonia at the same time. And I was younger at that time. I have no issues. Well, I had no knowledge of cancer or how to treat it, what to do with it. But I was like, you got to do something. It was just like, it's too much more. It's nothing more that we can do. You know what I'm saying? So, how
Yeah.
important is diet when it comes down to prevention? Because I know there's a over 65% of a lot of the foods that's on the shelves are being sold right now. Supermarkets are filled with chemicals and sugars and high sodium. So how important is it to eat from a natural state versus a more boxed or canned or extra processed type state? How important is it?
Yeah, it's probably one of the most important empowering interventions that someone can do. Uh, Conversely, if you look at how many cancers are hereditary, meaning that you inherit it from mom and dad, it's the genes that really uh, clinch the diagnosis. It's only 10 to 15% of cancers
Mhm.
that are really going to be driving your genetic outcome, meaning upwards of 85% of what happens to us is really preventable and within the realm of our control.
Right,
Even genetically, if you have a genetic predisposition, if you eat well, if you are relating well, then you really have much more favorable outcomes.
hmm,
We've learned a lot from sort of the blue zones of
yeah,
folks who live 80s, 90s, and 100s plus,
yeah.
which is usually in the Mediterranean basin, usually in the Japan basin, Okinawa, and the common denominators, in addition to genetics, are really um, very much plant-based, fermented, diverse diets,
Yeah.
much more natural.
Mhm.
Social interactions, so
Yeah.
being socially connected and non-isolating, as well as movement
Yeah.
and meaning and purpose. So those four components are absolutely essential, not just for long life and longevity, but for happiness, for quality of life, for not feeling like you're dragging your feet, and you pushing your 70, 80s and you're miserable, but for actually having meaning and purpose.
Right, right. And you mentioned the blue zones like, Japan and different areas of Mediterranean. Like these cultures, what I love about them, they're walking all the time, or they're riding bicycles, they're doing things, they're gardening, they're working in the yard, they're doing things that really keep their bodies moving. And then they're eating from a more from the garden to the table concept, which is a beautiful thing. And once I heard about the blue zone, I'm like, this is interesting, man, because um, we want to get to the state like here in the U.S. I know that a lot of things are banned in certain countries, like food colorings and different snacks and food products. A lot of things are banned, but me for myself being a wellness guy, I'm always focusing on I'm 56. I'm like, okay, I got to do better and figuring out I need to eat from a natural state versus from a canned state. But what do you say to potential customers or clients who deal with overall stress or emotional eating, because the two intertwine. Like people get so caught up in the cortisol hormones and they get so stressed, and then they go to eating stuff because it makes them feel good. But overall, down the line, it could cause a lot of cancers in their body. So when you talk to people initially, do you ever talk about the cortisol hormones and how they can really focus on stress management?
Yeah, absolutely. Excellent point. I'm just delighted to hear your comments on this. Um, so part of my intake and seeing patients, it's about a 3 hour intake really to see what their life is like, which entails imaging and screening and labs. And part of the laboratory panel, like you're saying, is cortisol, because it is very much correlated to their emotional health and psycho-emotional well-being. And there's been a number of really provocative studies that looked at, well, if you eat late, then you tend to die young, or
Mm,
younger than an average. And I did an interview on this. It's not necessarily that you eat late, and it's what happens if you eat late and what are you predisposed to do. Because then you're much more likely to have unhealthy behaviors and
mm,
isolate and
yeah,
do emotional eating across the board and emotionally calming behaviors across the board, smoking, drinking, substances that are very much counter to life and wellness and health and wellness, right?
right.
So it is absolutely imperative to address what's driving our psycho-emotional health and wellness, and emotional eating is a huge part of that.
Mm,
And what's been shown over the last, say, 5 years is that there's been a dip in middle-aged Caucasians, white guys, basically dying younger because of isolation and suicide and loss of meaning and purpose.
yeah,
Um, so it is an epidemic. At least 2/3 of Americans struggle with depression, anxiety, and feeling like they're just living in a bubble. So being really like tuning in, like I love your introduction. Prayer, meditation, mindfulness is absolutely essential. And sometimes people need to, we know that the vast majority of people won't change, right? But most people hit change or open to change when temperature rises and when something's bad happening.
right,
Only 15 to 20% are what's called towards people as opposed to away. So but evolutionarily, we as humans are away. We want to get away from danger, we want to get away from stress,
right.
and only when things really get bad do we seek change.
Yeah,
um,
yeah,
so it's really cultivating the insight awareness, and being open to, this, if I'm comfort eating or if I'm really stressed, it's actually a very good indicator, like a litmus test, that
mhm.
something's off with me and I need to attend to my emotional needs.
Yeah, yeah, yeah. That's awesome, man. It gets overwhelming sometimes with stress, but today in society, it's a lot of pressures, there's a lot of uncertainties, a lot of chaos. And then certain environments have a lot of food deserts. They don't have, the right produce to really make informed purchases in food. And also there's the economy for a lot of people too, that's is forcing them to get extra processed food, high processed food, fast food, because it's cheaper, and that's a problem as well.
It's
So
cheaper, and it's actually designed to give you those insulin and cortisol spikes. It's actually
yeah,
designed to hit your addictive dopamine pathway. Your
yeah,
body doesn't know the difference between a juicy steak, salty and fatty foods, sex,
right.
and cocaine. Ultimately, on the neurochemical level, it has
Oh,
the
wow.
same uh, expulsion of dopamine and norepinephrine, and you just feel high.
Yeah,
So the more that pathway is tickled in the brain, the more it wants it. So it's almost like we're all a little addicted to our way of life and way of eating. and
Yeah.
it's really mindfulness and awareness that it's really not going to serve me. And NCI studies, National Cancer Institute studies, are very much in cahoots with that, showing that about 70% of Americans really don't know what risk is, like what
Yeah.
constitutes risk.
Yeah. Yeah.
Um,
Yeah.
so it's really slowing down,
Hmm.
saying, "Oh, am I grabbing? Am I doing emotional eating? Am I isolating? Am I using this thing to basically tune out and get away, or am I using it to connect? Am I using it to be a better husband, wife, parent, kid? Like, am I using this to escape, or am I using this to engage and grow
Yeah.
up?"
Yeah. Yeah. A lot of people, they're using it to escape. They're
Yes,
using it to escape.
absolutely,
So
absolutely.
one thing I love about you when I did the background on you is that you believe in a concierge type approach to your practice. You believe that everybody is different. Everybody who comes to you is different. They got, different needs, different DNA profiles. And, what I'm saying, how important is for you to offer a concierge practice versus just, okay, just a standard cut of the mill type practice?
Right. I started this program actually in a traditional oncology setting. I was a medical director um, of a cancer center here locally, and was heading the survivorship program for my cancer patients once we cured them, so to speak, from their breast cancers and colorectal cancers, only to see that they would have a much higher rate of cardiovascular disease. They would be dying of clots, or autoimmune complications. And it really opened my eyes to the common denominator of illness. So I piloted this program that was really focusing on what are your risk factors, not averages, because we treat averages all the time, but
Right,
how do we personalize your risk? And we have very good modalities and ways of doing it. We have a personalized cancer risk calculator on the website that's free, so folks can go and check their risk based on their parameters.
right,
So how do we do that? And then how do we chip away, and how do we tailor treatment and prevention? So that's absolutely paramountly important. And unfortunately, the way traditional medicine works, especially in oncology, is, the higher the volume, the more the revenue, and the more the incentive to see more and more patients. But it's not conducive to individualized approach and really getting to know the person in front of you and treating that person as a real human being.
right, right,
So
right,
I cut the umbilical cord and started doing this, my dream job that I love, and it's been absolutely incredible. I get to spend 3 hours with my patients for an initial intake, really understand what's driving them, what their risks are, genetically, medically, psycho-emotionally, and how do we tailor
right.
change for them.
Yeah, yeah. That's that's beautiful, man. I love the fact that you was able to make that transition into that to this new practice and tailor, customize a plan for your patient to follow. And it's not just textbook. I've seen it. I know people who are dealing right now with cancer or diabetes, hypertension, heart disease, all these different things. And it seems to be just, it's not tailored. It's more like a cookie cutter program, or this is what it is. Okay, this is the pill for that, or this is the pill for this. And the side effects are really, really the things that's really derailing a lot of people emotionally because they got to deal. So then now they go back to their primary physician, and not everybody, but and then there's another medication prescription for the side effect, and that's the one thing over the years that really killed me because it's like I was diagnosed with type 2 diabetes years ago. I was able to reverse it, but I had complete side effects, and they gave me more medicine for the side. I'm like, wait, I'm about to go on medical bankruptcy if I continue to do this. So I had to really take back control of my own health. Now, so you mentioned more about your CRS, your cancer risk score. Now, describe everybody, what did you come up with that yourself, and why is it so important that people do that?
Right. I think as a prelude to that, I'm going to speak to diabetes and some of the metabolic factors because those are very much tied to our risk of complications, right? Of cardiovascular disease and cancer are the number one and two killers in the developed world, and the same folks who develop, strokes and heart attacks are developing cancer at a disproportionately high rate, and the same is true for cancer patients, autoimmune patients, right? So the cancer risk score that I've put together is really a composite of research and literature evidence, evidence-based medicine that we've seen for the last 20 plus years that are outlining, well, if you have diabetes and certain insulin levels,
Hmm.
certain level of ingestion, certain blood pressure, certain cardiovascular diseases, what are your risks of breast cancer, colorectal cancer, gastric cancer? And based on your age and based on your eating patterns, drinking patterns, smoking patterns, exercise patterns, what are those risks? What do
Yeah,
you do that increases your risk? What do you do that decreases your risk? And as a result, each risk has sort of a weighted component. So some, I don't know, for women who are on, say, hormone replacement for an extended period of time, that risk is much higher for certain cancers than if it's 1 to 2 years. So the risks are weighted, right? And they are time stamped, so to speak. They are some of it is ethnic.
yeah,
So certain ethnicities are at higher risk for certain cancers. And if they do some dietary or lifestyle indiscretions, they're at higher risk. So the cancer risk score is really a composite of those risk models that are available that really combine um, lifestyle, medical history, laboratory data. If folks have it, like so insulin levels, vitamin
yeah.
D levels, to give you much more of a comprehensive and personal glimpse as well, what's my health risk portrait? Like,
Mhm.
am I average? Am I above average? Am I significantly above average, or am I maybe below average? And what do I do?
Yeah, yeah, yeah. That's beautiful, man. I love to hear that. I love that. You mentioned hormone treatment. Are you talking more for men for as testosterone's replacement treatment, or just hormones in general?
It's for both. We part of the better living through pharmacology business that you were mentioning before with the diabetes and others. We really try to give a pill for everything, right?
Hmm.
If you are if you've got diabetes, here is your pill. If you've got emotional issues, here is your antidepressant. If you have a high blood pressure, let's give you a blood pressure reduction medicine, right? Which is often very, very important, has been shown to improve quality of life and quantity of life. Uh, but in its own right, it's often not sufficient, right? So it's if someone's really having emotional issues and emotional comfort eating and developing diabetes and a plethora of other complications, the epicenter, the culprit, the ultimate thing is not really to give her a medication to reduce her sugars only, right? You really need to address what's driving it.
Right.
So this for men, especially as we age, and we are figuring that we're actually much more mortal and we're not as impervious to life, as we
Yeah,
were in the 20s and 30s. That's very disconcerting. Or women
yeah,
who might be, going through menopause. It just sucks. It
yeah,
absolutely sucks.
yeah.
So the knee jerk is to, well, I'm going to replace your testosterone, or I'm going to put you on, industrial doses of hormone replacement so that you feel better. And some of it is very much understandable and could be helpful. And what's very, very important is to understand what those risks are, what the
Mhm.
timelines are, and what else needs to be done, right? If
Yeah.
it's me accepting that I am not as agile now when I'm in my late 40s as I was in my 30s, right? Some of it is like, okay, I need to do some growing up and acceptance. Like it's not going to be the same, and
Right.
it's going to be tougher, right? So I need to really dial in on my exercise and my walking routine.
Yeah.
Remember what you mentioned about the blue zones?
Yeah.
They weren't bodybuilding. They weren't lifting 200 plus pounds. They were walking. They
Right.
had it, basically lifestyle was had incorporated in it normally social ambulatory movement connections, right?
Right.
So it's not about bench pressing 300 plus pounds.
Right.
It's about movement socially, occupationally,
Mm.
lifestyle wise.
Yeah. Yeah. Yeah.
So that is absolutely imperative. And if we try to replace that type of activity with hormones, then we don't get benefit. We actually get damage. We get higher risk. For
Yeah.
men, it's with testosterone. For women, it's with hormone replacement for extended period of times. And we need to be very much, transparent about it, and not just, be kind and be nice for 5 minutes and give them a pill and have them then double their risk of breast cancer or prostate cancer. But
Right.
say,
Right.
okay, well, you can do this for X period of time. That's okay. And what else do we need to do to make you feel better and to address the underlying issues?
Yeah. Yeah. I know. I've been through the ICU. I've been through the medical system. Damn near on my deathbed myself. You know what I'm saying? And it was, you know, uh, every hour is taking my blood. I'm hooked up with to IV, and it was a very scary thing. And I was a younger guy going through a divorce and moving from New York to Atlanta. I'm 39, living with my mother. I was depressed, but for four
Mhm.
years I suppressed that depression with alcohol, parties, staying up all night, all these different things. And I also had a crazy career that was very demanding. So I
Mhm.
know firsthand how hard it is as a man getting older, the importance of taking care of yourself because that ambulance ride was the one of the most expensive ride I took, going two
Yep.
traffic lights to the hospital. And when I got there, I had no idea what was going on with me, and they told me. But when people was coming, I was walking up and down ICU, and people were praying. I'm hearing the little machine beeping, and the smell of death was in the air, very peculiar scent. And I said, "Oh, that scared me straight." Ever since then, I educated myself. I started working out, eating better, and stop drinking, stop smoking, stop doing all the crazy stuff that I was doing that was killing myself. So I started eating the foods that would cleanse me and not clog me and not make me feel weighted down and overwhelmed. And, I started thinking about my dad. I was like, man, I got to start doing what the population in the blue zones were doing. I was walking every day. I was hitting the gym, riding the bikes, eating right, I just love it, man. Right now, this is what I do right now with health and wellness, and I've been doing this for years, trying to get people to incorporate a more healthier lifestyle for a better quality of life and the better activities of daily living. Because once you get into the emergency rooms and the hospitals, and here come the treatments, I think that's when you start to feel worse because the social psychological things start to happen. You start to get mental health issues with depression, anxiety. We talk about fear or fight or flight. Like all these things start to kick in, and it really start to really mess with you. So listen, you've been compared to Peter Attia. How does that make you feel?
It's been it's a compliment for sure. So Peter IT, I uh, sort of indirectly get a lot of patience from him just
Ah,
because of his public persona and his presence on the internet and through the health community. We are really appearing to be very, very similar. I espouse and support many things that he holds dear, and is very much, I think, research based and very much in cahoots with life and wellness and health and wellness, right?
right.
So I am definitely not as outspoken as Peter Attia. I'm definitely not as higher paid as he, and the practice membership is much more affordable. That's for sure.
Yeah.
So, uh, so it's his. I want to thank him for indirectly sending so much business our
Yeah.
way, and we are considering actually reaching out to see if we can maybe hold hands a little bit more. I'm sure I'm not the only one who has those ideas, but just because it's been such an indirect, we've been such indirect beneficiaries of it, because you can really get a very similar uh, perspective and approach here locally, in the Denver metro, and we do have patients actually all over the states and internationally, and there are avenues to get that done. So it's very interesting when I started my practice, right? Because there were a number of other concierge, internal medicine, and family practitioners. But as far as the niche that I'm holding, it's super unique, right? It's oncology and hematology combined.
Hmm.
So it's a very different, not just um, perspective and time commitment, but expertise, right? So having seen the gamut of what cancer does and what the treatments are like, it's much more expert based. Well, how do we really um, prevent it? And if not prevent it, how do we do early diagnosis, early detection? Because that is very much uh, connected to saving lives, right? So,
Yeah.
how do we do early detection? How do we incorporate cutting edge molecular techniques and DNA testing and all of the incredible technology that we have in the States? How
Hmm.
do we take advantage of it, and how do we interpret it,
Right.
right? So, uh, and like, how do we really emphasize PDIT's approach to uh, what you've mentioned, blue zones and wellness and mental health, and really addressing some of the underlying drivers. And how do we empower people? It's not
Yeah.
about a beat down, like, oh, your risk is twice normal, you're such a loser, right? Let's shame you. That is going to
Mm.
create the opposite, right? How
Right.
do we really say, oh, this is really trauma based response that you have, the fight or flight that you mentioned,
Yeah.
um, and how do we calm your nervous system really to enable it to help you make better and different choices that are much more congruent with quality of life and quantity of life, with happiness, with connection, with exiting the rat race to the best of your abilities.
Yeah.
And if in that, like, you need to do some comfort eating a little bit, enjoy fine. That's okay. You can do some of that. It's not like 100, it's not black and white. You can really 10 to 15% of your diet, if you're consistently staying in the blue zone, so to speak, the 85% of the time, you can do whatever you want almost.
Mm. Yeah. Yeah. I'll be honest with you. I treat myself because me personally, I feel like I do well when it comes down to my nutrition, right? So every once in a while, I would treat myself to maybe a piece of chocolate. But I try to stay towards dark chocolate. Like I
Hmm.
love chocolate, but I like, okay, I love almonds or I love pecan. So I said, let's get some dark chocolate covered almonds, or something like that. I don't go overboard. I don't do any more fast foods and stuff like that. But sometimes I may have a taste for pizza, and I'm still thinking about the healthy version of it. I don't do any more sweets as much. I used to go crazy for Little Debbie's, the little apple pies. And
Yeah, yeah.
I said, Terrence, I said, listen, why are you craving these every other day, every 4 days, and you go to the store, you know it's there. So I had to condition myself to get off these Little Debbie's. And then there was the coconut donuts, the mini ones. It's like 8 of them in a thing. That used to be before I do a live show. Used to be okay. I have to have a Diet Coke and these coconut mini donuts, and I was like, stop it already. So I had to really get in tune with my emotions, my anxiety of doing a live show. And I said, you're killing yourself, right? And you're doing it every day. So it's like I had to really focus on my emotions and my mindset. And I thought I was treating myself, but I was really, really going through anxiety, and I was treating myself a little too much. So
I
now maybe on a Saturday, I might get like, some chocolate or, a few 1 to 3 ounces and stuff like that. I got away from the pasta and the bread. I got away from the dairy a little bit. Cereal was my thing, a lot of these healthy based cereals, but I was like, I don't get away from all that stuff like that. So let me ask you a question. What do you think about fasting when it comes down to maybe cancer prevention or rebuilding or rebooting your digestive health?
Right. Intermittent fasting, and by that I mean usually 14 to 16 hours of fasting, helps for a number of issues and with a number of issues and conditions like weight loss.
Hmm.
The when it's studied in more rigorous way through medical literature, it's all trends. It seems to trend towards improvement. It's not quite what we call statistically significant. It's not
Hmm.
quite the panacea, but the trends are consistently towards improvement with a big however. And the however is that especially for men and us aging over 40, when we are consistently eliminating another meal with protein, and usually plant-based protein, we slowly tiptoe towards malnutrition from a protein standpoint.
Mm.
So you lose about 1% of your muscle mass from age 40 on, and you start to doing that faster and faster as you age. So if if you're active and you're working out and quite physical, you typically need 80 plus grams of protein per day. If you're more in the gym, it could be 100 plus grams of protein. And if, say, you would get 20% from breakfast and you consistently eliminate it, then you start diminish, and you don't replenish it with supplementation, or you're not mindful of it, then you are going to be losing more protein mass over the ages. And that's what's been shown, that long-term intermittent fasting with protein losses
Mm.
causes protein malnutrition 15 to 20%. Right. So the question is why we're doing it. Are we doing it because we're trying to lose weight and it makes sense physiologically to have less over glycemic and glucose and calorie load in the morning? The morning signature is, well, let's kind of fast, let's break things down, let's burn out stores, not accumulate stores. So
Right.
physiologically it makes sense to do, provided that you really start bringing in those calories around brunch time. So what I typically recommend is that folks, have maybe a lighter dinner,
Mm.
say around 5, 6 o'clock at the latest, and then they don't start eating till really brunch time. So 10 o'clock on, right? So
Mm.
10:30, sort of the British brunch bit, right? And then much more, again, plant-based. And then if they need to supplement with pea protein, with whey protein, that would be consideration. Really, there are good options that
Yeah.
you can do. So it helps with the bottom line, helps with some weight loss, helps with dropping insulin levels, helps with metabolic syndrome improvement. Long term, you just need to know what you're doing and be mindful. And especially for men and for
Yeah.
women, but especially for men, protein is a big thing.
Yeah. Protein is a big thing. You mentioned from the last meal being like 5 and 6, like when the sun is going in a little bit, right? That should be
Yeah.
the last meal. Or like for me, I try to do 3 hours before I go to bed because I be honest
Yeah.
with you, I'm aligned with the sun. So if the sun is going in like 5, 6, depending on what I have to do,
Yep.
I'm already in a relaxed mode. I'm about to eat. Um, what do you say to people? Like so many people eat so late at night, and they eat heavy carbs, and they go to sleep on all those meals and all those carbs, and then wake up on their way to work. It's funny to me, like I've seen this so many times. Like, so, oh, we went to a restaurant, we had lasagna, and we had all you need breadsticks, we had the salad, and then I'm so bloated, and all of a sudden I got to go to work, and you end up in the you're going to get a grande latte and a medium muffin, like you're really, really compounding calories and you're really overworking your digestive system. You know, what, oh, we mentioned the intermittent fasting and, the times we should stop eating, what I'm saying? What will be the mindset behind people who actually go through that overload. Like sometimes like maybe it's stress, maybe it's just it's not a connection between the brain and the gut. I don't know what it is. What do you think it is?
The just evolutionarily and physiologically, evening time is the toughest time for us, right? It's scary, right? Just think about a baby crying, right, in a crib,
Hmm.
or when it's dark. It's just scarier, right? We don't want to, as kiddos, we don't want to sleep often with closed doors without a light because it's scary. It's unknown. It's threatening. So we carry those little boys and girls within us for the rest of our lives. And we typically do dietary and lifestyle indiscretions at night. And hence the reason why folks who tend to eat late uh, die younger. Just it's not
Mm.
necessarily even the eating, it's everything else they do around the eating. So by and large, and also depends where you live. Like now you are much closer to the equator, right? You in Georgia, you in the south, right? I just came back from Panama actually, and
Great.
the food there was
Amazing.
amazing. And I don't eat like this normally. Like
Yeah.
we don't eat like this. Okay.
Yeah.
So I'm still recovering. I'm
Yeah.
telling you. Um, so today is almost a week out, and I'm not quite at baseline, but
Uh,
gosh, I am getting back, and I'm welcoming that
yeah.
return. Right. So we we can do sort of these, vacation things, or enjoying some pasta or some meat. Uh, and I would really encourage folks who do it to slow down,
Yeah.
really eat slowly. Or
Mm.
if you normally want to gulp the whole thing, like do it at half rate,
Right. Yeah.
because that will, the faster we eat, the usually longer it takes us to be aware that we're actually super distended, we're super full,
Mm.
and we can't have any more. But if you do it slowly, then you're going to be much more cognizant. So
Yeah.
slowing down, just even physically putting that fork in your mouth, right, is going to make a huge difference.
Oh
And
yeah.
then, if you're in New York like you were, and that's where I did my training at Cornell, And it's the culture of going out at night, right?
Yeah.
And going to the restaurants. What's interesting is that um, it's the initial step that makes a huge difference. Meaning that if you start eating differently and you give yourself, say, I don't know, 15 to 30-day challenge and say, okay, I'm going to just do this for, I don't know, a month. And I'm going to incorporate one healthier thing. And then you try to go back to the previous thing, your body is going to tell you, I don't like it.
Yeah. Yeah.
So it's really trying to notice the difference and
Yeah.
sticking with something. And then the other thing which I mentioned, sort of meant to mention, is about healthy habits, right? And sort of cognitive distortions. People tell me all the time, but I love that pizza, or I love that steak. I really love that steak. Like, I love it. And
Yeah.
I'm going to deprive myself of it, but I'm not going to do it. And then my comeback is usually, we don't usually eat things we love.
Right.
Like, you don't eat your kids. Like, if you really love that cow, you would let it go.
Right.
Okay. You would give it a hug and you'd say, oh, you're so cute. You don't eat your dogs, you don't eat your cats. Like, you love them, right? And you don't
Right.
consume them, you don't put them in your mouth. So what you love is what it does for you.
Right.
It tickles you, it gives you that dopamine surge,
Yeah.
and it's really a huge part of this awakening is really addressing your cognitive distortions and cognitive processes that drive you to do this.
Yeah. Yeah.
So,
It's a
because if you put that donut in your mouth and you think, oh, this thing is going to give me diabetes and cancer, like, huh? My daughter came back with this, doctor joke. This fellow, she said, bought, a full pizza pie, and it was 8 slices, and he ate six. What does he have left now? And the answer was diabetes, right? So
right.
if you look at it that way, it's going to be much harder to consume this time and time again. Like,
Yeah.
ooh, I'm
Yeah.
actually damaging myself.
Right.
So
Right.
I love it. I love it, and I miss it.
Two things like a lot of people don't count their chews, and I read an article probably about 8 years ago. Like the French, their culture, like they really count their chews, like 27 to 30 chews before they swallow. And
Mm,
I said, I'm gonna practice that. Like my wife would say, "You chew so slow," and I said, "You chew too fast." People gonna
mhm,
think I'm not feeding you, right? So I really take my time and chew. So I break down the food, and so when you do that, you get to it digests better in your digestive system. You get the nutrients, you get everything in there, right? And one thing I realized, it takes 20 minutes before your stomach to signal your brain to say, "Hey, we're full," right? You got the hormones connecting, and one thing I realized with people, and sometimes for me, one of the hardest exercise for many people to do is push themselves away from the table or put the fork down,
right,
right? They got to, like, grandma used to always say, you need to eat everything on that plate. I can't do that anymore. I can't eat
right,
everything on the plate. Um,
right,
I've learned if I'm out eating, I'll pack it up, depending on what it is. I'm like, okay, I'm not going to eat all this. I'm gonna pack it away. But sometimes, if I'm breaking a fast and I'm happen to be at a restaurant, then I would eat everything on my plate because I'm getting that calorie in. But when I'm preparing meals at the house, I'm definitely focusing on portion control. And because I can eat, I have a huge appetite, but I know I carry all that weight in my core. So it's
mhm,
like I don't like that. I don't like the bloating. So I did February we did a 20-day Daniel's fast, right? So
mm,
from 6 a.m. to 6 p.m., no milk, no bread, no sweets, no sugars, all of that. So I did 28 days, just just water. I didn't even do any fruit juice. I don't drink that. Just fruit and vegetables. And surprisingly, I survived.
Mm-hmm.
I was like, whoa, wait a minute. Because normally I would have, breakfast and, it's like toast for breakfast. Then if I do a sandwich for lunch and, they say, oh, do a dinner roll for supper. I was really putting all those carbs in my body and it's breaking down into sugar and the glucose and everything. After the 21 days, I already created a habit. In 21 days, I already created a habit of fasting. Even to this point right now, today, only thing I had was a smoothie, a fruit and vegetable smoothie. And it's already 1 p.m. right here. So it's like, I'm doing good. I'm not really concerned about food like that no more. I feel great. So it's a great thing, man. I want
It's
to.
amazing. It's
Go ahead.
amazing. And let me just I'll just give you my 2 cents because you are in a league of your own, Terrence. Like you're super awesome, and it took you some time to get here, and it could be very overwhelming and almost unrealistically. It's like we're extraterrestrials, really talking about this to a common mortal, right? So it's what's really important to understand, and I can't emphasize this enough, is that uh, we really need to start at our own pace, but in a consistent fashion, and
Mm,
do things that are easy. Like, so for instance, I'm just going to be like generalist, right? For men and women, the easy is different. um, and like for men, it could be I'm going to reconsider maybe a drink and cheese,
mm-hmm.
and do meat next. For women, it's going to be like I'm fine giving up meat, but I want my cheese. So I don't ultimately care how we start, but it needs to be just a little bit. It needs to be just barely uncomfortable, not let's go and do the 12-hour fast and I'm going to not eat anything and just have like a consistent thing, because that's gonna in my experience, and tell me what you think, but it's just not going to be feasible for most folks. And
Yeah.
my whole thing, and what the literature and the psychology of this, and we have lots of data on this, is it's really not, you're not running, it's not a sprint, you're running a marathon. And
Mm-hmm.
in order for you to be successful with this, you really need to make consistent, incremental, positive changes.
Yeah.
That was my 2 cents.
Yeah. And your 2 cents is invaluable. I mean, I got a question. You mentioned Panama, and I
Yeah.
know everything is like super fresh. From the garden to the table. It's from the seeds, from the vine, it's from the trees. You know, what was that like? You said you're just getting back to some type of normalcy because you're home now. You're resetting. Do you find that nutritional lifestyle better compared to being back in the States? Are twofold. Are you going to incorporate a little bit more of a Caribbean tradition eating into the modern style?
Sure. Yes. So it was actually fascinating uh, to be there now, because I haven't traveled to Latin America for a while. Especially was with my family, so the whole the whole plan went, and it was telling you I need a vacation from this vacation. So
Yeah.
it reminded me how little the variety of fruit and vegetables there is in tropics, right? Normally, so things that grow there are amazing, like papaya, mango, pineapple,
Mm,
and we would just live off of that. But if you want to have tomatoes, cucumbers, so things you're a little bit more used to, most of that stuff is exported. I mean, sorry, imported.
mm,
So what we take for granted, right? It's just not as common and not as built into that culture in Latin America. Uh, so what grows is yummy. The
Yeah.
fish is amazing. Uh,
Yeah.
and the meat is actually much better. But then if you want to do more Mediterranean based salads and what have you, then it's just not going to be as good. Ceviche, like that's going to be woof, right? So you really need to look as to where you live and
Hmm.
what's available, right? So thankfully um, and actually very interesting. So there were like when we go to a supermarket, they would have lots of fruit and berries that I exported from California, and you try it, and like, oh, God, that is just so not good. So
Yeah.
you really need, as opposed to me in Colorado, right? Or when I was training in California, that was super good and fresh. So
Uh-huh.
you need to really look where you live and what's available and what's fresh and what's yummy. You're not going to say, I need to have X amount of berries no matter where I'm at. Like papaya here, I'm in Colorado, it's just quite disgusting, I have to tell you. That was my breakfast. It
Yeah.
was amazing. It was amazing.
Right.
So you need to really look as to your locale and your local availability, and garden to table, and what really makes sense, and what's going to make sense for you in Rochester, New York, in the winter is going to be very different than what makes sense for you in Atlanta, Georgia,
Right.
or Panama in the winter, right? It just it doesn't equate.
Right. Right. When I stayed upstate New York, getting fruits and vegetables like that was never on the radar. Yeah, I might have an apple here, and I might have a banana on
Hmm.
there. But
Hmm.
it was more. I'm super bachelor. It's more. Hey, let's go get the Caribbean food. Let's go get the beans and rice over here at the Cuban place. This, the Have It Your Way restaurant. It's the Kentucky. It's all those different things. And then when I got my first marriage, it was more of she was more like a can base, box base type, chef. At the house,
Yeah.
everything was corn, everything is high sodium, or rice and roni type thing. But we was younger there. I was in my this was like 1997, so I didn't know too much then about proper eating or nutrition. The only thing I knew about was food. So think about high sodium box products, canned goods, the sodium content, or even the popular frozen products, healthy products. I didn't know any better, but as I got older and went through my life experiences with my health journey, started to get educated on reading nutritional labels and focusing on uh, whole foods versus the chemical based foods. That was a game changer for me. And now I look
Absolutely.
at, yeah, now when I look at these products on the shelves, it's like I look at it all like poison. I was like, these things are poison. And when I talk to a lot of my clients when we do consultations or whatever, I'm like, look, that's the way you have to change your neurologistical program and then look at these particular things as rat poisons, right?
Hmm.
The things that they deem healthy, you gotta look at it as nothing. Even if it says sugar free or fat free, you still got to look and say, look, this thing got high corn syrup and sucralose and fucalose, and you got to look at these things and know that your body is going to break that down as sugar, right? So you got to really pay attention to the labels. Even with your salad dressings, you get the creamy stuff. I was like,
Yep.
I look at all those things as poison. So, doctor, any final words you want to leave with everybody and tell everybody how they can connect with you and all that great stuff before we close out?
Yeah, absolutely. Appreciate it. I was just going to mention that we're totally on the same page with nutritionally, and the program for our preventative and screening wellness really incorporates a year of nutritional help and support, just because of the labels and just because of all the craziness that happens, and support. Like, you can't just tell them, eat whole food, plant-based, pescatarian fare with fermented foods, and shake your hand and that's it. You need to really support folks and walk alongside them. So that's why nutrition is really part and parcel of this. So we what we encourage people to do is obviously go on the website. It's pmccdenver.com, and that's the website for the practice. There are a number of educational resources, the free cancer risk assessment, and those who are interested can always reach out to the practice. My wife actually runs the practice, so I'm blessed with her being both the nutritionist support as well as helping with the logistics. She is a wealth of resources, and can direct people depending on their interest, depending on if they're looking, for gut health program, or if they're looking for cancer early detection or cardiovascular preventative programs. We really try to individualize what we focus on for different people, depending on their age, depending on what it is that they're dealing with. And I'd say that Yana, my wife in practice manager, is really a key player on the team. She is the boss. I report to her directly. So she is incredible in being able to tell folks, well, maybe this is not even the best fit. Go seek this local resource, both nutritionally or GI wise, as well as helping to tailor what the next steps are. So I would say website would be the next meaningful intervention, and stop to check the philosophy, to check and connect with the practice and have a conversation if there is interest. We have a mailing list and educational podcast list, so there is an opportunity to sign up for that, also a free resource. And the goal really is to educate folks, make sure that there is a movement in the right direction, and it's going to take time and consistency and effort. And with those components over time, there is just an incredible change towards health and wellness. It's not going to happen magically. There is no magic potions that we dispense. We don't practice voodoo medicine. So it's just it's consistency, and it's mindfulness, and
Right.
it's connectedness, and in the process, beautiful things happen.
Yeah, that's beautiful, man. It's such a breath of fresh air to talk to a physician such as yourself and your stature, who focuses on the integrative health and a more holistic health versus, the big pharma, or, the traditional type services of doctors and hospitals, which I mean, I get it. That's the standard. It's been the standard for years. But very seldom I ran across a doctor who makes the transition from that to, more concierge and integrative and more holistic health. And that's a beautiful thing, because it's kind of, for me, like, even one of my physicians, last time I went to him, he was stressed. There's a lot of client base, and his PA was a tad overweight last time I see it. So it's like, it's kind of, it's kind of catch 22 sometimes. So physicians are sometimes overwhelmed themselves. You guys are human, and you got to deal with your different emotional and backgrounds, and the spiritual concept of it as well. So it's refreshing, man. Like you mentioned, you're working 3 hours a day. Whereas most physicians, they probably working 12 hours a day. They
Oh,
overwhelmed.
I don't work 3 hours a day. My intake for new patients is 3 hours.
Got you. That's what I heard.
So,
Okay.
yeah, yeah, yeah,
My
yeah.
apologies. My
3 hours a day
apologies.
would sometimes be very welcome. No, no, I haven't gotten that early yet.
Yeah, yeah. Like 3 hours a day, that would be amazing.
Yeah.
That would be amazing as well. So, ladies and gentlemen, Dr. Mark Levandovsky, a MD, a 20-year-old triple board certified physician on oncology, hematology, and internal medicine. So he knows what's going on, right? He knows what's happening. Uh, he leads the leading concierge care practice in his area, in his field. His specialty is finding and locating heart disease and cancer and preventing it before it becomes a risk in a person's health. And so we pretty much preventive medicine, integrative medicine, right? And he also developed the cancer risk score, which is a CRS quiz, right? And you can go to the website. What is it? PMC
PNCC Denver.
denver.com.
Yeah,
Right.
one word.
Yeah. And you can go check that out, right? It's a 5-minute self uh, assessment to understand your overall risk, right? And
Exactly right.
Doctor, much continued success to you, sir. We really appreciate the opportunity to connect with you and learn from you, learn more from you, and really increase our audience awareness of preventive medicine and what you're doing in the Denver area and around the world. We are in much gratitude for you to take your time out because I know you're super busy and we don't want to hold you too long, but I just want to say thank you so much for coming on. And it's a blessing to have this opportunity, sir.
Thank you so much, Terrance. Really a pleasure speaking with you. You are an amazing man. I am really impressed with what you've accomplished, uh, and it's really not about absolute value where you are, but really the change in the trajectory, right? So,
Yeah.
based on what the life story that you've shared and where you're coming from, it's just my head's down. You're an inspiration. Thank you so much for the podcast and putting this together. And likewise, wish you all the best and happy to be a resource.